Another important thing to watch for to make sure that baby is safe is their breathing. So this is a common thing that we see in newborns called periodic breathing. And babies can kind of have some funny breathing, and so it can actually be normal. So I wanted to talk to you about what is normal and what is not normal. So with periodic breathing, babies will sometimes take a few short breaths and then have normal breathing after that. So sometimes it will kind of sound like that, and then they'll just have regular breathing for a little bit, and they might do that again. So that is actually okay if you notice baby doing that. It is just their way of learning how to breathe, and they start to regulate their breathing, and it is safe for them. What would be unsafe or something that we would worry about would be if we notice consistently with time, baby is breathing really fast or really hard or just working to breathe. Babies do have different rates of how fast they're breathing. In the beginning, it is a little bit faster, but if you noticed with time that baby was breathing more than 1 time a second, so you're counting out seconds, 1, 2, and baby is breathing, taking breaths quicker than that, that would be something that if you're noticing that over, an hour, 2 hours, it's persistent, that would be something that we'd want you to contact your medical provider for. If it is very brief that they're doing that, like you're noticing, oh, they did that for, a few seconds and then it went back to normal, that would be okay and most likely consistent with that periodic breathing for baby and okay to monitor. Another thing to watch for with their breathing is just their work of breathing. So a good way to do this, if you're concerned about their breathing, is just to go ahead and just undress them, because the best way is just to look at their chest and their head and how their muscles are moving to see if they're breathing too hard. If you actually completely undress baby, if you're worried about their breathing and you really want to look at their chest. If babies are working too hard to breathe, they're a lot of times going to be pulling in around the muscles of their chest, and we call that retractions. And some babies will do that when they're just like stretching or moving. Sometimes when babies are hungry, they'll briefly do that. If they're just like breathing a little quicker because they're excited to eat and they're hungry, that will happen. But if it's persistent with time, that would be something that we would want to look into. So if you're noticing the pulling in around the ribs, this can happen either between the ribs or under the ribs. So it's just going to look like deep breaths, and then they're pulling in around the ribs. So that's a good thing to look for. The other places that you can look in their head movement. So if they're just laying flat on their back, their stomach should be moving gently with breaths. But if you're noticing that their head is like moving up and down, like they're kind of bobbing their head, trying to take breaths like that, or they're pulling in like around their neck, or sometimes their nose will kind of like the outer part of their nose will what we call flare, like they're trying to get breaths in. So they're doing everything they can to get those breaths in and working hard. That would also be a sign of trouble breathing. So if you notice those signs of trouble breathing that we talked about with the persistent fast breathing or the pulling in around the ribs, just signs that baby's working hard to breathe, that is a medical emergency, and that is a reason to take your baby to the ER. So nasal congestion, or just kind of that kind of a sound when baby is breathing of just kind of, it sounds like they have like a little bit of snot in their nose, that is pretty common in babies and in newborns. And it's something that we usually don't get worried about in and of itself. We would just want to make sure that we monitor those breathing signs. And if you do notice other signs of illness, like baby is having a lot of discharge out of their nose, and then again, we're watching for fever, those would be signs of things that possible illness that we would want you to take your baby to their provider for. But if you are just noticing at home that they do have a little bit of nasal congestion, it is safe, if you want to try to help them with that, to use a bulb suction syringe. So you are going to first squeeze it before you place it in their nose, and then you're going to just gently place it in there, and then you're going to pull it out to get the snot out of their nose. Sometimes you will hear that sound, but you won't be getting a lot out if they're not truly sick and they just kind of have that newborn congestion. That is okay. But if you want to try to help with that more, you can use nasal saline, little drops, and just put a couple drops in each side of their nose and let that sit for a few minutes, and then try the bulb suction again. And sometimes that can help you get a little bit more out.